Hi, my name is Yolene Lofton, nurse turned champion for nurse advocacy and patient safety. And today I'm going to be talking to nurses about what the most common errors are in the workplace that have been compromising nurses, not only their license, but placed on probation, license ending up in suspension or revocation. So what are some of the most common recent issues in the workplace that have been compromising nurses' license? Number one, it's been on the top of the list for years and still today, medication errors, giving patients the wrong medication, the wrong dose, the wrong route, the wrong time. I always want to make sure you check those 5 routes, especially new grads in the workplace. It continues to be a top problem and error, and that's still on the list. Number 2, documentation. You never want to over-document or under-document, and always use wisdom in what you document, because what you do, say, or write can be held against you in a quasi-judicial court of law, also known as the Board of Nursing. Thank you very much. Not prioritizing ABCs. You always want to make sure airway, breathing, circulation are the priority, and everything else on the bottom of that totem pole coming after. Always prioritize your work accordingly. Body mechanics. Nurses have been getting implicated in terms of patient falls, and of course, nurses getting injured in the interim. And so you always want to be mindful of body mechanics when it comes to yourself and patient for the most part. Incomplete documentation. What you don't write can be held against you. Make sure you're documenting appropriately. Not following the right chain of command is a big one. Incomplete reports. Coming to work under the influence. CRNA got into a lot of issues recently coming to work drunk. Of course, started anesthesia on a patient, passed out on the OR table. Thank God the patient did not, die or anything. But of course, an anesthesiologist was in the local area, of course, in the OR, and they were able to get help while dealing with the CRNA that had passed out from high levels of alcohol. Please, nurses, please be careful. And so DUI issues, of course, is a big one. What gets reported locally in the criminal court of law can also roll off to your nursing dynamics. And so you want to seek help for your issues so you won't compromise your nursing license. Drug abuse, substance abuse, narcotic abuse continues to be a big one for nurses. Nurses have been even going to new employers and testing positive when it comes to drug, whether it's marijuana, meth, what have you. And those have been reported to boards of nursing in recent years. And so you want to be mindful, nurses, to really and truly seek help for whatever stressors that are causing you to turn to substance abuse, so that don't trickle on to your nursing license to compromise your career. Also, self-admission. Always seek the help of an attorney if you ever find yourself in a position where you have to meet with not only managers sometimes, or when they try to get a witness involved to try to implicate you. You always want to be mindful. Self-admission can do some harm, and so be mindful of that. Treatment errors, pressure ulcers, lack of reporting those, that continues to be a problem, especially in long-term care facilities. So you want to be mindful of those errors as well, nurses. Not paying your federal student loans have been a big one. I know Florida is a big state now. They're reporting professionals if you're not paying your federal student loans on time, or if those loans are in default. So you want to make sure that you're staying on top of those in order for your license not to be reported to your local board of nursing office in your state. Not renewing your continuing education units on time, or not fulfilling the requirements based on your state laws. That has been a big one in recent years, and it continues to also be a big one. So nurses, you want to make sure you stay on top of those. Clinical errors by students and preceptors. Preceptors are responsible, as you all know, in the workplace where clinical is involved, to provide oversight to nursing students. And so you want to be mindful to, not overtake on more than you can handle. And of course, every state is different and requires different ratios when it comes to students and preceptors. So you always want to be mindful of that. Falsifying timesheets. That has been a big one in most recent years for travelers or staffing pool nurses. Falsifying timesheets, of course, to get more dinero. And so you want to be mindful that it's not worth it. So be mindful of that, nurses. Fraud in terms of Social Security fraud with patient information and data that nurses have access to in the workplace. A lot of nurses have been getting in trouble for selling patient information. There was even a big TurboTax fraud in one of the bigger states where a nurse was selling patient information to, companies. And so you want to be mindful, nurses. Big no-no, big no-no. And there's also privacy violations and HIPAA violations also continues to be a large problem in the workplace. You have to use wisdom in absolutely everything you do, nurses. It started off a long time ago here in Florida, where one nurse, when we had that Versace death, got in trouble for giving information to one of those large news providers. And so you always want to be careful, nurses. Big no-no. Never to share information on absolutely any patient at any time. That's a big no-no, and that Versace case was a classic example. Narcotic abuse, whether it's in nurses abusing drugs in the workplace, playing like they're assigning those drugs to patients and actually documenting that they gave it to patients for pain, when in actuality nurses have been abusing those narcotics, or not turning in the appropriate number of narcotics to pharmacy when patients are discharged from the hospitals. That has been a big problem and continues to be a problem. Nurses, get help for your issues, but don't compromise your license once again, because it is not worth it. Discrepancies with the Pixies dynamics involving narcotics. Same thing. Nurses, there's a lot of nurses addicted to substances in the workplace, and that continues to be a big problem. And so nurses, you want to be mindful. Utilize your EAP program and get help, but don't turn to drugs. My God, continue to say no to drugs. Testing positive for drugs, once again, substance abuse, marijuana, alcohol, DUI issues. Many times those are local criminal court dynamics, but they can absolutely roll over to your nursing board and compromise your nursing license when it comes up for renewal or reinstatement. And you want to be mindful of that, nurses. Be super careful. And you also have patient abuse, which continues to be a big one. Physical abuse, sexual abuse, unfortunately, in the workplace by healthcare professionals. Come on now, nurses. Whether it's nurses who've been found abusing patients coming from OR or recovery room or long-term care facilities or even mental health facilities, that has been a big one. Refrain from that drama, nurses. It's not worth it. It's not worth it. And of course, falling prey to what stressors you have going on in your life is, the final one. Many nurses go through so many dynamics in life, whether it's in your personal life, your families, the workplace, or what have you. And you're dealing with issues of your own, domestic violence. And so sometimes nurses are battling with a whole bunch of personal things that they haven't dealt with themselves. And of course, that spews over in the workplace and cause your work dynamics to be implicated based on what you're going through. So you want to be sure and mindful to get help and seek counseling, utilize your EAP services, speak to someone in your faith-based organization, get help, but don't go through issues alone. And bullying in the workplace is another issue, and that can compromise not only your license, but your mental capacity, your life, your psychosocial dynamics. And so you always want to make sure that you seek help for those dynamics, nurses. But these have been the most common recent issues in the workplace, nurses. I just wanted to share it with you, and hopefully you'll be more responsible and mindful so that you can be more aware of these dynamics. And of course, share it with a colleague, share it with friends, share this video rather with colleagues or friends in the workplace, and reach out for help if you need to. All right, by any means necessary in order to protect your license. Thank you for tuning in. Subscribe to my nurses, my YouTube channel, and I'll see you next time.